My name is Craig Bunnell. I'm the Chief Medical Officer, and I came to the Dana-Farber in 1990 as an intern. At that time, the Dana-Farber had inpatients in the Dana building, I think on floors 12 and 14, and the house staff, the residents and interns who took care of the patients, were half from the Brigham and half from the Beth Israel Hospital. And I think there were about 40 beds in the Dana-Farber Hospital. I think it was really the experience that I had both with the patients, the types of patients that we took care of, the care of the relationships that you developed with them. And it was also the fact that I was really surrounded by the icons of oncology at the time. George Canellis, Bob Mayer, Steve Sallin, Tom Fry, Baruch Benacerraf. Not the only Nobel laureate that we have, and it was these were the people who were teaching us, my mentors, and to be able to work with and study with and be trained by the world leaders in oncology was just an experience that was unparalleled. Once I started here, I was in the Women's Cancers program, and I took care of, and still do, take care of breast cancer patients. I came here originally as a clinician, taking care of patients in the Women's Cancers program. At that time, I was also involved in clinical research. Over time, I became more involved in the organization, the management of the breast oncology center, and gradually increased the work that I was doing in terms of managing the clinical aspects of care delivery, over a period of years, my responsibilities expanded. I eventually pursued more training in that area. I got my MBA, and then increased my administrative, operational, strategic responsibilities here. But I never stopped seeing patients, which is something that, that's why I became a doctor. I love that about being a doctor, and I don't think I'll ever give that up. So when I first came, there was the Dana building and the Mayer building. There was no Yawkey, there was no Smith building, there was no Longwood Center, there were no satellites, there was no Chestnut Hill, and really over the last 15 to 20 years, we've expanded and grown exponentially. We now are delivering Dana-Farber care across southern New Hampshire and the eastern part of Massachusetts. We have satellite centers where a third of our volume, a third of the care that we deliver takes place in those satellite centers. And then most recently we opened up Chestnut Hill. That doesn't include the other relationships that we've built with other healthcare systems and hospitals across New England, actually nationally, expanding into other states and collaborating with those. So it's, when I first came here, we had, I think, 40 beds in the Dana-Farber. We now have, we deliver our hospital care, our inpatient care, in the Brigham and in partnership with the Brigham. And we have 5 or 6 times the volume that we had at that time. And understand that at that time, most chemotherapy was being delivered in an inpatient setting. When I was a fellow, you spent most of your time actually admitting patients for chemotherapy. And And at that time, we had not, our medications were not so good at controlling the side effects of chemotherapy. So patients got admitted to the hospital. You basically put them to sleep for the next 3 or 4 days while they were getting their chemotherapy. And then you allowed them to wake up and they could go home. Now, 95+% of oncology is delivered in an ambulatory setting. We can control the nausea. We have supportive medications that, at the time that I started, Zofran was just starting to come out. And at that time, you had to have, the attending sign off to administer Zofran to a patient because it was so expensive and so limited in quantity. And at that time, we had many patients who died of infection and bleeding complications. We now have supportive therapy so that the risk of infection, the risk of bleeding, the side effects of treatment, nausea, et cetera, are incredibly well controlled. And that's really allowed us to move the treatment of patients out of the hospital and into the clinic. And now our therapies, we have more and more oral therapies, which allows patients to just stay in their homes and go to work and lead normal lives rather than spending 3 or 4 or 5 days out of every 3 weeks in the hospital. I still see patients, so I am still a clinician, but I spend a lot of my time actually trying to improve the systems of care that we have to make our care more effective, more patient-centered, safer, of higher quality, to allow patients to lead their normal lives outside of the treatment of their cancers. Over the last 10, 15 years, there have been tremendous changes in the way that we deliver care using technology. And I would say that the electronic health record is actually a big one of those. The reason for the development of the electronic health record has really been one of a story of safety. I think it's worth actually noting, when you talk about the Dana-Farber, and its impact on patient care and its impact on cancer care, I think you can't do that without talking about the role of the Dana-Farber in the patient safety movement in this country, actually in the world. In 1994, Betsy Lehman, who was a 39-year-old woman who was the health editor for the Boston Globe, died from an overdose of chemotherapy at the Dana-Farber. It was a catastrophe. I mean, it was a tragedy. But the way in which the Dana-Farber responded to that, with openness and transparency, is something that I think was really unique among cancer centers, among hospitals, in medicine in general. And it really was the catalyst to the start of the patient safety movement in the country. Nobody admitted mistakes. Nobody looked at errors at that time. There was an assumption that, of course, everything that we did was safe because people were vigilant and people worked hard, individuals worked hard to take great care of their patients. I think what there wasn't as deep an understanding of is the importance of developing systems of care, systems that actually ensured that the care that was delivered was safe and was high quality. And the Dana-Farber really started that movement. And it's become, out of that tragedy, it changed the culture of the Institute, a change in the culture that persists to today, 30 years later. And it changed the culture in medicine around safety and quality. And I think that's something that we can be very proud of. I think it's something in which we have been leaders in research, in basic laboratory research. We have been leaders in clinical research and translational research. We've been leaders in operations. We've been leaders in patient safety. We really, I think, are responsible for the focus on safety and quality in healthcare today. When I think about my career and my impact, I'm not, nor I think could I have been a Nobel laureate here. I'm not going to make the discovery of the next great cancer treatment. So I don't see myself as sort of, winning the best actor. I think my role is to be the best supporting actor. My role is to help my colleagues, to help the institute, to help my colleagues who are in labs, my colleagues who are in the clinics, the people who are delivering care, to do that in the best possible way, to maximize their potential, and by doing that, I'm having a part in the successes that they have. I'm having a part in the transformation of healthcare that they're helping to accomplish. And so if I get the Best Supporting Actor award, I'm really happy with that. Since I entered oncology 30 years ago, there's been tremendous change in our care for patients, in the treatments that we have for patients, in our understanding of cancer, and in the cure and the prolongation of life and of good quality of life, and the rate at which that is improving continues to increase exponentially. So the discoveries that have been made, the ways in which we're treating patients with personalized therapies, the way in which we're using immunotherapies, the supportive care that we have, et cetera, I think I am looking forward to a day when I don't have a job, because not because I have lost my job, but because it's not needed any longer. I have a patient who every year at Thanksgiving sends me a Thanksgiving card that thanks me for the care that I gave her and wishes for me to be out of a job in the not so distant future. And I'm aligned with her on that. And I actually think that it's when I first began taking care of patients in oncology, the median life expectancy for a lung cancer patient was less than a year, and that's changed dramatically. The median life expectancy for a patient with stage 4 melanoma was about 6 months. We have patients now with stage 4 melanoma who have been alive for more than a decade, and with great quality of life. So I am really optimistic that cancer is going to be a very, very different disease 10, 15, 20 years from now than it has been, than it is today, and certainly than it was 30 years ago. The COVID vaccination for our staff was actually one of the best days that I've ever had at the Dana-Farber. And it, I think, exemplified the culture of the Dana-Farber, the people of the Dana-Farber. So I think what is special about the Dana-Farber are the people who are here, the commitment that they have to mission and the commitment that they have to each other. And the COVID vaccination day was a day in which everybody who was here was a volunteer, and we had been separated for so long that when we got back together, and it was this act of volunteerism, of commitment to each other. It was a time of bonding. It was reaffirming our caring about each other, which is really, it's part of we talk about our core values and, compassion and respect for our patients and each other. And I think it was really about that. So I think I have many great memories. The writing in the PMC with my colleagues, for years now with the Women's Cancers Program, Women's Oncology on Wheels. Wow. And I think other great memories are, I still remember as a resident of being on rounds with George Canellis and Bob Mayer, and having, again, these icons of oncology teaching me oncology. It's, who gets that?